We've been discussing this part of the electronic health record called the patient file. And within it, we're saying that there's something called a patient chart and something called patient workflows, or the patient workflow. Let's look at this concept of the patient workflow in a little bit more detail and start with the question, why don't we just call it a form? The term form has been used throughout medicine to describe standard collection of information. Forms could obviously be paper-based or they could also be digital, but in general parlance, it means the same thing. A form is standard information collection. And now some physicians in American healthcare may not be used to using forms regularly when they think about recording information about a patient. They may be more used to free text notes, but many physicians do use some sort of standardized collection tool to help with their reporting, and especially throughout the world, many non-clinicians regularly use forms in the collection of patient medical information. Sometimes these forms have free text fields, other times they have discrete answer choices such as drop-down menus or multiple select options. And it's really easy for anyone to create a digital form today. You could use SurveyMonkey or Google Forms. These products are widely available, and they have this simple drag and drop environment. And so about a year ago, I began to ask myself, why can't we just use off-the-shelf form builders such as SurveyMonkey or Google Forms or REDCap to collect patient data in an electronic medical record? And the reason we can't do so and call it an electronic medical record is because the above systems, although they're effective at collecting information, a medical workflow involves more than just collecting patient information. And this is why I use the term patient workflow to highlight that we're talking about functionality within an electronic health record more than just a form. And so, what is a workflow? Well, right now I'm thinking about a workflow broadly as something which both allows you to capture data and to display data. And when we think about capturing data, you could break that down into two entities. You could have both the capture of patient information, clinical note, recording a physical exam finding, recording lab results, and you could also have capturing data being thought of as recording information, specifically actions about a patient's care. So booking an appointment, ordering a medication, scheduling a lab test, these are actions. And so if we wanted to build an effective workflow builder for an EHR, which could work in a lot of different care settings, you need components that could, one, display information about a patient, such as their active medications, their past lab results, their active problem lists. You need components that allow you to collect information about a patient, drop-down questions, free text answers, and even pre-built questions. And then you also need to be able to place actions about a patient's care, such as place a medication order or book an appointment. And often these three functions which are required within a workflow builder are often needed even within the same component. For instance, if you dragged into your workflow a component which was called active medication list, that component probably needs to display information, needs to show you the list of meds. That component needs to be able to capture information. You need to be able to stop one of those medications and record the date it was stopped and the reason why. And then you need to be able to place actions, such as ordering a new medication probably from within that component. And to my knowledge, I have not seen a workflow builder or an EHR that has this type of components inside of it with this level of flexibility, where you'd be able to go into essentially a giant sandbox or a giant toolbox, which would contain many different components, which you would find elsewhere within the EHR, but split up into discrete, smaller entities, which allows you to drag them into the order that you actually want to interact with them within a dedicated workflow. Let's look at a quick example of what a workflow might look like if you built it using such a workflow tool in an EHR. In this first hypothetical example, we'll look at an HIV outreach worker who was following up on a patient who missed the prior day's appointment. And then we'll look at the exact same example, but if we didn't have a workflow builder available to us. So imagine each row here, essentially, if you were reading this on the blog, or each of these entities in the workflow builder being its own self-contained component that you could just pull in, drag and drop style using a workflow builder. So you might want to start off with displaying some information about the missed appointment. You want to drag in the patient's name, their age, their demographics. You may want to bring in a summary card for their HIV care program. You might want to bring in a summary card that shows their HIV encounter history. And then you'll want to bring in a card that shows the date of the missed appointment and why it was scheduled. You'll then want to probably move into being able to pull in some information to make it easy to contact the patient, such as pulling in their phone number, pulling in their relative's phone number. And you'll probably even want to drag in an action button, which allows you to dial the patient directly from the system if you're using this, for instance, on a cellular-enabled device. And then once you've called the patient, you're going to want to document some follow-ups. You're going to have some structured question fields, such as the number of call attempts and who the phone belongs to, who answered it, and if the patient was contacted or not. And then you may want to have a free text box, which allows you to write some notes down from your conversation. And at the end of this workflow, you're going to want to document some actions, and not only document those actions, but you're going to want the documentation of that action to become real, meaning you actually want to book a follow-up appointment. You're going to want to refer for an in-field follow-up. You're going to want to set in a reminder to call the patient back. And you both want to essentially have a component for each of those actions inside of your workflow so that you can perform that action right there and then, to both book the appointment or the follow-up and to record at the same time that you've essentially done that. And so this would be a really slick workflow, for instance. But if you didn't have a workflow builder and all you had was a form builder, all you could do was essentially would be to have a simple form which had that structured data about the phone call. Did you make it through to the patient? Did you contact them? Did they pick up? What's your clinical notes? What's your plan of action? And then separate from that form, you need to allow the clinician to essentially, they would have to search through the whole EHR to perform the rest of their workflow. They'd have to flip through the patient chart to find what their backstory was about why they have HIV and what their HIV history is. They'd have to flip through to see what their HIV encounter most recent events were. If they've ever missed it before, you'll have to flip to the other part of the chart to try to find the patient phone number to contact them. And then once you finally do get through, you'll need to flip back into the form section of the chart to then record and document that call. And then after the call, you'd have to then flip back to the regular part of the EHR, and then you'd have to go to the appointment scheduling module, and then you'd have to go to the to-do referral module. And then this is kind of a disaster of a workflow experience. And this is why clinicians hate the modern EHR, is because it's just not streamlined. It's not designed for dedicated workflows. But on the other hand, if you could actually have each of these entities as individual components that could be brought together into a dedicated workflow, you could really increase the efficiency of that clinical experience and the ease which they operate the EHR. And I just want to end this post with an idea that, in theory, for most users whose work involves routine workflows, so obviously, a complex consultant, they might have very different types of workflows they engage in, but most healthcare workers in general have a series of routine workflows that they go through. If you could build those workflows in for each type of care provider in an organization, in theory, they don't actually ever have to leave the workflow section of the patient file. And so that means that they kind of each have a fully customized experience based on the type of work they do. And this is kind of a really cool way to think about an EHR. And so the next posts will go on to discuss in the future about the workflow builder in more detail, such as how these components need to be built, connecting them into terminology services, logic services, and creating pre-built options to make it really safe and easy for the people who are building these workflows. So it's almost as easy as building a SurveyMonkey or a Google Forms form.